It's World IVF Day. A recent report shows that nearly half of Manitobans believe in considering family planning between the ages of 25 and 30. What does this mean? Fertility is top of mind. Here to chat about IVF's role in that and Fertility Specialist, Dr. Stephanie Appleby. Good morning.
Good morning. Thanks for having me.
Thank you for being here. Just to start us off, how common is infertility in Manitoba? Are these numbers rising?
Yeah, we have a lot more data than we have in the past. We keep in mind that IVF fertility treatments have only been around, under 45 years with that first IVF baby, Louise Brown. So we have more and more options for folks, and it does affect more people than I think most Manitobans realize. 1 in 6 Manitobans and people across the world are affected by infertility.
So when should people consider IVF or freezing their eggs?
That's a really personal decision. I think everyone's fertility journey is different. What we do know is that our biology begins to change around age 32. And that's a lot younger than I think most people realize. Unfortunately, 40 is not the new 30 when it comes to our eggs. And egg freezing can be offered to folks who have medical conditions, who are looking at gender-affirming care, who are looking at social reasons for freezing their eggs to delay fertility for a later date. And all of those considerations can be discussed if people are interested in finding more about their fertility. They can contact Heartland Fertility Clinic here in Manitoba.
So it really sounds like it's not a one-size-fits-all. Everybody is dealing with their own issues, I should say. It is expensive from what I hear. How much is it and what's the process?
Yeah, that's the challenge that we've been facing here. We really believe fertility care is health care. This year, the government has expanded what we have in Manitoba as a fertility tax credit. So there's 40% of the total cost of any IVF or assisted reproductive therapy treatment cost that patients can get back. There are also some really great fundraising efforts, really passionate folks here in Manitoba. The Gift of Love and Hope is one of them, who are looking to support people through the use of bursary. So there's a lot of good expansion happening, and we just hope that it can be more. There are many treatments, though, that really don't require a cost on the patient's side. Heartland offers full-service IVF care. That includes investigations. Sometimes surgery is the answer for folks. Sometimes it's medication. All of those don't involve assisted reproductive technologies.
So it sounds like a process. So they come to you. What does that look like? Is part of it getting their bodies right as well?
Absolutely. There's any number of reasons why people may be facing fertility challenges. And the first step is to acknowledge that somebody may have questions about their fertility, to recognize that it's been too long or there's too much going on, there's something that doesn't feel right. If somebody's experiencing that, whether it's trying for 6 months or a year and they haven't had success, or there's something different about their biology and they want answers, people can contact Heartland Fertility on their own by email or phone. They can have a referral from their primary care physician, at which point they'll be connected with a specialist who can do some investigations into what the cause may be. And depending on what that cause is, then they can be directed towards the appropriate therapy. And sometimes, as I say, that may be medication, that may be surgery, or that may be advanced reproductive technologies.